Hi everyone, welcome to this video about Introduction to Pregnancy. Today we are going to discuss some issues about pregnancy in the TCM point of view. So what is pregnancy? It is referred to the period in which a fetus developed inside a woman's uterus. And the whole process usually lasts about 40 weeks, measured from the last menstrual period until the day of delivery. This is divided, the whole process is divided into three segments. That is, we call trimester. So the first trimester is starting from the very beginning until week 12, and the second trimester starting from week 13 to 28, while the last trimester, that is the third trimester, starting from week 29 to the very end of the pregnancy. That is the day women gave birth to the baby. So during the first trimester, and consumption occurs where a fertilized egg is what we call the zygote, start to travel along the fallopian tube all the way down to uterus, and it implant itself to the endometrium. This is a process called implantation, and placenta will form across the border of the between the uterus and the zygote, and it will serve as a channel for the nutrients to pass through from the mother's body to the fetus. And the zygote now will develop into an embryo, and it will continue to grow. So during this trimester, there are several changes to the fetus and to the pregnant person. So for the fetus, all the body major organs start to grow, and the heartbeat is now beating regularly. So usually it will happen since after week 5. So this is one of the main and the first examination we do to pregnant women. So normally we will observe regular heartbeat starting from week 5. By then, when we observe the ultrasound, there should be some flashing light appeared on the screen. In other words, if we don't observe this kind of changes, if we don't observe the flashing lights representing the heartbeat, there is some issue happening. Either the fetus is not growing or it grows too slow, not in a normal pace. And during this period of time, fingers and toes starting to form, and the fetus will grow into like for around 3 inches long and weigh nearly 1 ounce by the end of the first trimester. And the nerve and muscle start to work together, so the fetus can now make a fist. So the eyelids are formed, but it will remain closed until around week 28 in order to protect the eyes. And about the in person, it will certainly feel some certain extent of fatigue, sometimes even with headaches. And the breast will become tender and swollen, and it's kind of ready for lactation. That is the secretion of milk. And there will be also mood changes because the entire body is changing in a form of transition. So in terms of emotional changes, there's a significant uh, changes before and after pregnant. And during this period of time, apart from the morning sickness that we might experience, pregnant women will also crave for certain food, and usually it's sour in taste. On the other hand, there will be oversensation of certain smell, causing nausea, indigestion, or constipation. For pregnant women, the first trimester will experience certain extent of weight changes. So it's a result for the hormonal changes during this period. And very often, pregnant woman will also have polyuria. That is a increased frequency of urination. Starting from week 13, we'll enter second trimester. During this trimester, the embryo continue to grow, and we can see some genital development around week 13. So if we want to, we can actually observe the genital development, and at this point, we can literally uh, uh, tell about the sex or the sex of the baby, of the embryo. And by week 20, the embryo start to move, and in a way that the pregnant person can actually feel. And footprints and fingerprints are start to develop in this period, and there will be a regular routine starting to develop to the fetus on the fetus. They will start to wake, they will start to move, and they will start to sleep in a regular routine. And it's is probably happening in the 24th week. So during the second trimester, uh, the first bowel movement of the fetus happen. We call it meconium. And fetus are able to see, to hear, and make a sucking motion and scratch. Those instinct movement. And the taste bud, skin, hair, and nails are starting to form. As we said before, the fetus is now sleeping and waking regularly as a daily basis. And for male fetus, the testicle begin to move down to the scrotum. And for female, eggs started to form in the ovaries. And bone marrow is starting to make blood cells, and there are linugo, that is the fine hair, covers the body of the fetus. And for the pregnant person, the abdomen starts to expand as the fetus grow, and there will be stretch marks starting to appear on the abdomen, thighs, breast, and buttocks. So during this period of time, there may be some kind of edema. So the ankles, fingers, and face may swell. And around the nipples, there are areola. The areola will start to become darker, and and as well as the skin on the face may also be darkened in patches. And during the third trimester, this is the last trimester, the bones are soft and yet almost fully formed, and the fetus eyes can now open and close. So during this trimester, we are actually expecting the fetus to be delivered anytime, sooner or later. So normally the baby will live until week 39 to 40 weeks. That is what we call full-term infant. However, sometimes the delivery may happen earlier than expected. So for the infants that is born before 37 weeks, we call it preterm infant. For the infants who are born even earlier, that is 34 to 36 weeks, we call it late term pregnancy. And for the infant who born in 37 to 38 weeks, it is called early term infant. However, sometimes the delivery may happen later than the normal 40 weeks. So when the infants are born in their 41 weeks until 41 plus 6, we call it late term infant. And any infant that was born afterward, we call it post term infant. During the third trimester, the fetus organs and the body system are formed, and continue to grow to mature. And the bones are starting to harden, the movement become more and more noticeable, and there are eyelids opening, and the sensation of light can be can be observed. And the lung formation of the fetus start to complete, the lanugo start to fall away, and a waxy coating called vernix developed. And the fetus will drop lower in the person abdomen, and usually it will turn head down toward delivery. So by means of the fetus dropping into the lower part of the abdomen, it is kind of what we call uh, and this is actually a process that the pregnant woman can literally feel it. It will feel as a sudden emptiness in within the abdomen. And before that, the fetus will actually obstructing the entire abdomen. So at that time, the pregnant woman will normally feel the stretch in diaphragm as well as the oppression towards the bladder. However, when the fetus goes down to the pelvic cavity, it will suddenly feel emptied and the pressure will suddenly release. For the pregnant person, uh, it's common to for them to experience certain extent of heartburn because now the fetus is getting too big, and this will literally uh, create a pressure to the stomach region, to the diaphragm. So heartburn in this trimester is common, and it happened to have shortness of breath as well. And the same reason, because the oppression is getting more and more significant. And there are even more swelling, even more edema developing around the ankles, face, and finger. And people will also experience insomnia, that is difficulty in sleeping, and also the mood change again, and anxiety during this trimester is very likely. As long as especially when you're expecting to delivery, you are facing a tremendous uncertainty that will obviously leads to the mood changes. Some pregnant person will have a leakage of milk from the breast and nipples start to change in structure. Even more frequent urination will be recorded, and as the fetus is getting bigger and it's more occupying in terms of spaces, hemorrhoids is also common to happen because the growth of the fetus will commonly result in certain extent of constipation, and this will promote the hemorrhoids from happening. And during the near the end of the trimester, there are some contraction in the uterus. We call it Braxton Hicks contraction. So the difference between Braxton Hicks contraction and the real contraction is that the Braxton Hicks contraction usually do not indicate labor. Sometimes we just refer it as a as a practice, as a rehearsal of delivery. And sometimes we refer it to a false labor. However, the Braxton Hicks contraction is so much different from the real contraction. And the differences will in terms of the cervical dilation, frequency of contraction, strength of contraction, length of contraction, location of pain, and change with movement. Usually, the false labor do not cause cervical dilation, but when true labor contraction happen, it will always cause cervical dilation. That is, the cervix is starting to dilate which is to facilitate the delivery process. In terms of the frequency of contraction, Braxton Hicks contraction usually is not that regular. So sometimes the contraction is happening randomly. It is not at a regular basis. However, for true labor contraction, the timing between the contraction is regular and it will come closer and closer from time to time. And it will become more and more frequent from the time being and until the and it will happen continue to be more frequent upon the time for delivery. For Braxton Hicks contraction, it is not usually not very strong. It is a weak one. But for true labor contraction, it becomes stronger and stronger over time. The false labor length is uncertain. The contraction is uncertain. So sometimes they just contract, sometimes they don't. And it will usually last until the movement of the woman. So when women move, the false contraction will stop. For the true labor contraction, it usually lasts between 30 to 90 seconds, and it grew longer and longer during the progression of the delivery. For the location of pain, the false contraction or false labor is happening usually in front of the abdomen. And for true labor contraction, it starts in the back and move around to the front eventually. And the false labor will stop if the woman move. However, the true labor contraction will continue or become even stronger, regardless of the woman's movement. So about the EDD, that is the estimated date of delivery. In common language, we call it due date. So the due date is count from the last menstrual period in normal situation, and we can calculate it by from the last menstrual period by adding the month with 9 or minus the month with 3. And for the day of the last menstrual period, just simply add 7. And this will give us the due date. For example, if the last menstrual period is starting from January 1st, the due date will be October 8th. Because January is the first month. When we add 9, it comes up with October. And if the day is 1, we add 7 on 1, that becomes 8. So the due date will be now October 8th. Another example, if the last menstrual period is happening on 2019, July 21st, so since it doesn't make sense for July, like the 7th month, to add 9 equals to 14. So simply, we just minus 3. So the 7th month is July, minus 3, it is April. Okay, but remember, the April is talking about the April next year. So if it's 2019, the due date will be 2020, the April on 2020. And again, if the day is 21st, we add 7, it will comes up with 28. So the due date now will become the April 2020 April 28th. So during the 3 trimester pregnancy, pregnant woman will have tremendous changes and physically and emotionally. So with regard to the physical changes of pregnancy, it involves the secondary amenorrhea, the presence of slippery pulse, and the happening of morning sickness, in medical term, it's hyperemesis gravidarum, and the uterus is certainly enlarged, breasts start to change, and the abdomen will be also enlarged. So in terms of the secondary amenorrhea, as we said in the amenorrhea topic, amenorrhea has many reasons. There are so many reasons causing amenorrhea. Some of them are normal changes of the body, and some of them are a kind of disease. And obviously, having amenorrhea during pregnancy is a normal situation. In TCM point of view, it can be explained by the deficiency of yin and blood. During pregnancy, the yin and blood is intended to drain downward all the way to the chongren and also the uterus so as to nourish the fetus. And if the excessive yin and blood is continues to drain downward, our body will experience certain kind of deficiency. And the deficiency of qi and blood is the reason amenorrhea happen. On the other hand, the some of the yin and blood will flow upward to the breast in order to synthesize milk. So this will again create some kind of deficiency, and it will in turn result in amenorrhea. In TCM words, the uterus now store the essence but not dispel, and this can explain the amenorrhea. So the second change will be the slippery pulse. Well, this slippery pulse is slightly different from what we normally experience in certain different kind of disease, such as like the dampness or the heat accumulation. So during this period of time, according to Tai Chan Xingfa, which is a TCM classic in 17th century, it said that qi and blood are accumulating in the uterus, causing pregnancy. So when qi and blood are accumulating in the uterus, that is the lower jaw of the body, the pulse representing the lower jaw, that's the qi pulse, must be slippery and rapid, indicating the abundance of qi and blood in the lower jaw and in the uterus, and of course in the kidney. It further said that when women are pregnant at her mid-age with qi and blood deficiency, the pulse may not be rapid, but it will appear thready instead, because thready is representing qi and blood deficiency. However, despite the threadiness and weakness of the pulse, the qi pulse may still appear to be slippery. And that is the same reason why the qi pulse is slippery, because the qi and blood are now, despite of the fact that the qi and blood is deficient, they are still continue to accumulate into uterus to support the pregnancy. So this is described as yin, that is representing qi pulse, is beating hard, while it is so much different from the yang pulse, that is twin pulse. So by means of yin is beating, yang is different, it means that this is one kind of it's considered as a pregnancy pulse, and mainly it is because of the qi and blood are in deficient, but yet they are accumulating inside the uterus, causing the excessive pulse happening in the lower jaw or in the yin pulse. And the third changes during pregnancy is the morning sickness, that is hyperemesis gravidarum. So the reason we got morning sickness is that the flush vessels is now comparatively in excess. While the qi and blood in flush vessels, as it is or literally mentioned in the vessel's name, it is flushing upward. So if the qi and blood within the flush vessel is in abundance, it will certainly cause vomiting and nausea because now the qi is flushing upward and it is violating the downward qi of the stomach. So it will kind of like interfere the normal downflow of the stomach qi, but it in turns uprising. So it will have vomiting or nausea sensation. However, the other parts of the body, when we look into the other parts of the body, other than the flush vessels, the qi and blood elsewhere is comparatively insufficient. So despite of the nausea and vomiting causing by the morning sickness, or causing by the excessive flush vessels, pregnant women will at the same time experience tiredness, fatigue, or even dizziness. And this can be explained by the deficient qi and blood. So why is there deficiency in qi and blood? Because the qi and blood is now all in the flush vessels. And this will mainly occur between week 7 to 13. And this is a normal case. It doesn't mean that it won't happen uh, outside this period. In clinic, uh, the morning the morning sickness can happen as early as week 5, and it may continue to happen until until the very end of the day, of the delivery. And there are also significant changes on uterus and the breast. So for the uterus, it is enlarged and softened because the fetus within the uterus is continuing to grow. And the uterine cavity is now increased from normal 5 millimeters to 5,000 millimeters right before the labor. And the breasts now become larger and swollen. The nipples and the areola become darker but larger. And the colostrum, that is the first secretion of milk, can be noticed as early as 16 to 19th week. That means the colostrum is happening before the delivery actually happening. So for the whole pregnancy process, we have to look into the kidney tiangui chongren uterus axis again. As we said, this axis is governing the entire process of women's life, including the reproduction. So the one of the the use of kidney is to store the inherent essence from the prenatal essence, and it governs the reproduction. So at this time, when kidney qi is mature in the adolescence period, it starts to secrete a substance called tiangui, which is responsible for the fertility ability of of young women. So the secretion of tiangui is governing by the mature of kidney, and the tiangui is promoting growth and grants capability to reproduce. It in turn clears the conception vessel and maintain the blood flow, and it also enriches the flush vessel. So the conception vessels now and the flush vessel is both in abundance, and for conception vessels, it is unblocked, and the qi and blood within the conception vessels can move freely and smoothly. And the presence of Tiangui will add to the Chongrenmai, and that is the flush and conception vessels. And these two vessels are regulating the qi and blood in uterus in order to perform a regular menstruation or pregnancy. So when the qi blood in Chongren are affecting the uterus, it happens in two ways. So in normal situation, the the uterus is alternatively being stored or released in terms of qi and blood. So when the uterus start to release qi and blood, menstruation occurs. And when it stop releasing, but started to store, it is what we call the post-menstrual period. The qi and blood within this period of time is accumulating and getting prepared for the next period. However, when the qi and blood in the and when the uterus stop releasing, but only focusing on storing, that does not happen alternatively anymore. So now it is stop releasing, but storing purely. And during this during this period, the pregnancy happened. Mm. All right. So when we look into the whole process of pregnancy, in order to treat pregnancy disease, there are a few things that we have to consider. Number one, the yin and blood will downflow and accumulate it in Chongren. The reason for this happening is to support the fetal growth. Without the yin and blood supply, the fetal will not grow as scheduled. So in order to support this fetal growth, the yin and blood has to be downflowed and has to be accumulated within Chongren. But the downflow and accumulation of the yin and blood towards the Chongren will eventually causing yin blood deficiency in the entire body. Because now the yin and blood is accumulating only in certain part of the body, that is the Chongren. So here, the the yin and blood deficiency is likely to happen. And it will further uh, leading to the yang in excess. Of course, that is talking about the relatively. When we have yin or blood deficiency, yang is relatively in excess, and this by definition, this is deficient heat. So this is the first changes of yin and blood. So the second thing we have to consider during pregnancy is the qi movement is being obstructed. And obviously the obstruction is caused by the fetus in the uterus. And it will get worse when the fetus continue to grow. Okay. The larger the fetus grow, the more serious the obstruction is. So it will happen throughout the entire pregnancy process, and the qi movement will become more and more obstructed. Also, we have to consider the personal constitution changes. So we can look into this point in the point of view of organ disharmony or qi blood imbalance. And also, we have to be aware of the invasion of the exterior pathogen. Because number one, the during the pregnancy process, we have organ disharmony, we have qi blood imbalance, and it will certainly lowers the immunity of the what we call in TCM, that is the zheng qi, right? So when we are weak in zheng qi, the invasion is likely to happen. And the second thing is the invasion of exterior pathogen will not only affecting the pregnant woman itself, but sometimes it will also affecting the fetus. So you have to be very careful about this happening. With regard to the treatment principle of all the pregnancy related disorder, there's one single most important principle among those principles, that is to treat the disease while at the same time securing the fetus. So always remember to secure the fetus anytime you are treating pregnancy related disorder. Okay? Because now you are not only focusing on the health of the pregnant woman, you are also focusing on the safety and the healthiness of the fetus. So for any time you want to treat pregnancy disease, one thing you have to remember, you always have to bear in mind, is that you are not only treating the disease, you are also maintaining pregnancy. So other than treating the disease, you will also have to secure the fetus at all time. We certainly don't want to treat the disease, but risking the life of the fetus. So all we can, and you have to, and actually you have to do it at the same time. So how do we secure the fetus? One key point is to tonify the kidney, because kidney is to store the essence, serve to store the essence, and it also governs the whole fertilization process. The second thing is to tonify the spleen, because spleen is a postnatal foundation and it is responsible for the qi and blood generation. And apparently, the qi and blood is one of the supply that are maintaining the normal growth of the fetus. So in order to secure the fetus, there are only two main things we have to bear in mind. One is to tonify the kidney, and one is to tonify the spleen. So we have several herbs to secure the fetus. There is not much. We have a lot of herbs, but not many of them has this effect. So it's better for you to remember all of these fetus securing herbs that you can use anytime according to your TCM pattern diagnosis. But these herbs can certainly help you to secure the fetus while treating the disease. The first one is 菟丝子. So this herbs is kind of a parasitic plant uh, that serve that are maintaining their own life by absorbing the nutrients from the host plant. And other similar herbs called 上寄生. And 上寄生 in Chinese, it literally means the parasitic animals, parasitic plants that rely on a tree called 桑树. Because 上寄生 means 桑树, right? That is a tree, one kind of a tree that its leaf is called 桑叶. And the branch of the 桑树 is 桑枝. There's a lot of herbs that that is made out of the sang plant. So 上寄生 is a parasitic plant that uh, that grow around this 桑树. Right? Well, these two herbs, 菟丝子 and 上寄生, is one of the most important herb to secure the fetus. And the reason we think that these two herbs is help to secure the fetus is that in TCM point of view, the 菟丝子 and 上寄生, such kind of parasitic plants, is actually doing the same thing as the fetus did. right? They are so similar in terms of maintaining their own life. The parasitic plants rely on the nutrients from the host, and the fetus is rely on the nutrients given by the mother. So it's kind of similar in nature. And this is the reason why 兔丝子 and 上寄生 has such a securing fetus ability. Okay. And the third herbs will be 续断. This is all a kidney tonifying herbs that also secure the fetus. And similar herbs called 杜仲 is also as a main herb to secure the fetus by tonifying the kidney. So when you look into 杜仲, it is kind of a bark of a plant. And when you look closely enough, there are kind of a little some threads. Um, there are some white threads connecting the bark. So and this structure is extremely firm, and you're not that easy to break those bonds. So this secure secure nature of 杜仲 will tell us they are secure to fetus. Ajiao is another common herb to secure the fetus, and this is made from the boiling and condensing the skin of the mole. Okay? So this kind of an animal herb. And Huangqing, we all know that Huangqing is a cold herb that served to clear heat originally. And Huangqing, unlike other cold herbs, it helps to secure the fetus by clearing the heat and stabilizing the blood, and by clearing the blood heat. And in clinic, you will certainly notice that there are and that it is so common that the pregnant woman is experiencing certain kind of heat accumulation throughout the pregnancy process. They become irritated, they become thirsty, they become restlessness, they become anxious, they become grumpy, and they become anything that is related to heat. So in that case, Huangqing is helping a lot in order to secure the fetus while clearing the heat for the mother. Huangqing, together with the next herb Baizhu, is considered the most important fetus securing herbs in the past. And since Huangqing is to clear heat and Baizhu is to strengthen the spleen. As we mentioned before, tonify the spleen, strengthen the spleen is important in order to secure the fetus. So whether the spleen is in deficiency, Baizhu can serve the purpose to secure the fetus, as well as to strengthen the spleen. The next herb, Sharon, serve to regulate qi and especially the spleen and stomach qi. Normally, we use Sharon to treat the bloating, vomiting, and any stomach ache, stomach discomfort caused by the spleen and stomach imbalance or disturbance. So now Sharon is not only treating the spleen qi obstruction, spleen qi stagnation, or stomach qi stagnation, but it also helps to secure the fetus. So as you can imagine, the most appropriate timing to use Sharon is that when the fetus is unsecure during the morning sickness. So the insecurity of fetus, the miscarriage, is uh, common to happen in in the first trimester. That is before week 13. Most of the miscarriage happening in the first trimester. And this is when, at the same time, the morning sickness is happening. So by using 杀人, we can treat both the insecurity of the fetus and also the restlessness in the stomach and spleen. Similar herbs called 紫苏梗 serve the main purpose to regulate qi while secure the fetus. So normally we don't want to regulate qi or move the qi a lot when the fetus is imbalanced or insecure. So you will always want to stabilize. But if there is qi obstruction or qi stagnation, you still have to treat those stagnation by regulating the qi. So you probably want to choose some herbs that can regulate qi and at the same time secure the fetus, right? And next one would be 艾叶. 艾叶 is also one of the herbs to secure the fetus by warming the uterus and warming the meridian. So quite the opposite to 黄芩. When there's heat accumulation within the uterus, you probably want to use 黄芩. But at the same time, if the meridian is cooled, or is invaded by cold pathogen, you have to warm the meridian and at the same time to secure the fetus. So 艾叶 is one of the herbs that you can choose. And there's one more called 竹茹. 竹茹 is a herb that that serves to clear heat and to clear the phlegm. And the second purpose using 竹茹 is to stop the vomiting. So it is kind of cold herbs trying to clear the heat, but at the same time to secure the fetus and to stop the vomiting. So according to the TCM pattern, whether it is in uh, spleen deficiency or it is in kidney deficiency or it is with coldness, it is with heat accumulation, you can, or it is in qi stagnation, you can choose these herbs to treat the problem. In the opposite, there are a bunch of herbs that is restricted in order to protect the pregnancy. Okay, some herbs are to be restricted, some herbs are to be avoided. That is not suggested to use during pregnancy. It includes those laxative herbs, lubricative herbs, stasis removal herbs, qi dispersing herbs, or toxic herbs. So for the first one, the laxative herbs, it means those herbs to serve to treat constipation. For example, 大黄, 芒硝, 饭泻叶, or any herbs that can promote the bowel movement. So you certainly don't want to have this effect because try imagine the laxative, those herbs trying to cure the constipation is actually a down-bearing herbs, right? Now the bowel movement is not going downward. You certainly want to move the qi downward. But for pregnancy, it is such a contraindication. The same thing happened for those what we call lubricative herbs. For example, what we call lubricating herbs is number one for those herbs which promote urination, and the second one is to lubricate the bowel movement or to lubricate the herbs itself is mucus secreting. For example, 车前子. When you boil 车前子or when you soak 车前子under water, there are some lubricants actually literally coming out from the herbs. And this will help to soften the bowel, to lubricate the gut. So as and that's the same thing happening to promote the bowel movement, to promote to urination. So for stasis removal, that is referring to any herbs that serve to clear the stasis, to remove the stasis, to boost the blood circulation. So as we said, pregnancy is a process for purely storing, but not moving and not dispersing. So you probably don't want to disperse the chi or remove the stasis unless it is totally necessary. And of course, during pregnancy, the toxic herbs is better to avoid, right? So, with regard to the pregnancy-related disorder, okay, actually, according to the textbook, we have a lot of pregnancy-related disorder, okay, including bleeding during pregnancy, or what we call unstable pregnancy, miscarriage, morning sickness. The first three disorder, we'll go through it later in the next coming lessons. But apart from these three disorder, we still have a lot more, including the abdominal pain during pregnancy, the fetal growth restriction, that is, the fetus stop growing at some point, and the prolonged retention of the dead fetus, referring to the failure for the uterus to push the dead fetus out of the uterus. And also include the fixation during pregnancy, edema during pregnancy, or what we call the polyhydramnion, that is the excessive amniotic fluid accumulated within the abdomen. And we also have preeclampsia or eclampsia, where preeclampsia and eclampsia is one of the critical situation that is mainly happening in the very end stage of pregnancy. And this is a life-threatening case that we suggest not using only TCM as the only uh, practice to help this situation. This is better to refer to the emergency in order to save the pregnant woman's life. And also we have urinary retention during pregnancy. In Chinese, we call it 转包. Uh, and this is literally the retention of the urination because the fetus is getting bigger and bigger, and it is applying pressure to the bladder. And there is so much more pregnancy-related disorder that we can have an opportunity to go through. However, the most important part, the bleeding during pregnancy, unstable pregnancy, miscarriage, morning sickness, we can talk about this later coming lesson. All right. So this is the introduction of pregnancy. And after this lesson, we'll go to the next part, that is to discuss the coming topic of the pregnancy related disorder. Right. Thank you so much, and we'll see you later.